pilot project for medical cannabis studies. We are in 2021, and fortunately, medicine has evolved. In addition to the new medications being made available to patients, the mentality has also changed for the better. We used to have the choice between different medications. It was good, but there was better. That is, having the choice between different medications and medical cannabis treatments. Indeed, giving a patient the choice to choose between a medication, which is chemical, and a medical cannabis treatment, which is natural, is a good mentality evolution. Before moving on to the subject of medical cannabis, I would like to discuss 2 points. First, the medications. They are not evil and forbidden. It would be distasteful for me to speak ill of medications, as these medications have saved lives for thousands of people and almost certainly will in the future. These products, chemical and synthetic certainly, are short-term life-saving. What kind of person would I have been to be anti-medications? Certainly ungrateful. So, in order to be fair and reasonable, I would like to put the products called medications on an equal pedestal with medical cannabis. That said, you have the right to choose the product to relieve your suffering or other symptoms of your pathologies. If a person experiences too many side effects caused by a medication, they are entitled to a medical cannabis treatment that produces no or only minimal side effects. There are also other people who want to live a more natural life, especially consuming natural and genetically unmodified and unprocessed foods, etc. Natural cosmetic products such as shampoos, deodorants, lip balms, etc., and or food without the addition of processed products. This for reasons of ethics, personal values, or awareness of the fragility of our planet. These people who suffer from a pathology or a polypathology have the right to choose for a treatment with medical cannabis. A second point that I want to emphasize is natural medical cannabis. There are products sold in pharmacies which, as mentioned, cannabis-based products. These products, which are based on cannabis, do not fall under the category of the previously mentioned natural cannabis. This deserves an explanation. Cannabis-based products are products that are manufactured in a pharmaceutical laboratory and sometimes patented. An example is the product Sativex. Before giving my observations on this pharmaceutical product, I would like to thank the British pharmaceutical company GW Pharmaceuticals for the accessibility and opening of the doorway for the more open mentality for medical cannabis. For a large part, thanks to the product Sativex, the fear and lack of knowledge, education of doctors regarding medical cannabis has been greatly reduced. This is thanks to the pharmaceutical company's openness to this subject, on which there was previously a rather taboo aspect. However, I have seen patients who did not respond adequately and especially satisfactorily with this product. I am not talking about relieving pain, nor about the effects of decreasing nausea and vomiting, but about the problem of unwanted effects on a psychological level. Particularly, I've noticed attacks, mild or severe, of anxiety, which for me is totally not acceptable as a side effect of medical cannabis. Knowing that healing does not only take place on a physical level, but also on a psychological level. This is why when I talk about medical cannabis treatment, I refer to not pharmaceutical cannabis. Cannabis that is not pharmaceutical consists of the flower of cannabis. The flower is part of the medical cannabis, which is natural. The flower is the ingredient in medical cannabis on which I provide education about. The flower unaltered and not soaked in oil or alcohol. I could inform you about the altering and the soaking of the flower in the future, but in general, my education program is focused on the flower au naturel. In Denmark, the pilot project Medical Cannabis Studies has been started since 2018. On YouTube, you can watch the interview between Dr. Julie MOLTKE and Dr. Tina Horsted entitled The Holistic Medicine Podcast, Dr. Tina Horsted, Medicinal Cannabis for Chronic Pain. Dr. Tina Horsted has had in her consultation practice 5,000 patients for 2 years and prescribed them with medical cannabis to relieve their pain symptoms in her pain clinic. The results of this project are so convincing that a request for an extension of 4 years has been requested. Dr. Julie MOLTKE states, we have a 4-year pilot study in Denmark where you can prescribe medicinal cannabis, and even though it is not been approved and tested. Don't forget that Dr. Tina Horsted in her care has included inhaled cannabis flowers. The positive results on patients are therefore the most certain. Since 2021, we have such a pilot project for studies on medical cannabis in France, especially in the Ambroise Paré Hospital, half an hour by public transport from Paris under the supervision of Professor Didier Bouhassira, a neurologist. One concern I would like to share with you is the following. After observing the results in patients consuming pharmaceutical cannabis, so as previously mentioned, cannabis-based products, my fear seems justified to me. What I hope and expect from these medical cannabis pilot projects is the proper use of medical cannabis, taking into account the type of the product and the method of administration. The type of product, only the flower of cannabis. The method of administration, by inhalation only. These proper ways of consuming cannabis require cannabis plants to be grown, especially for therapeutic reasons. I would like to repeat once again the words of Dr. Julie MOLTKE. Prescribing medicinal cannabis, and even if it is not approved and tested. In other words, in countries where medical cannabis is also not yet legalized and regulated, this does not stop starting a pilot study project for medical cannabis. On behalf of all the patients who ask for it, who need it, who suffer. The oath of Hippocrates, which all physicians must read before receiving the title of physician, makes an allusion to this. Will apply for the benefit of the sick all measures that are required. I will prevent disease whenever I can, for prevention is preferable to cure. This is heartwarming and hopeful. Finally, to close this subject, here is a picture taken in the St. Anna University Hospital in the Czech Republic. You can see a patient preparing to inhale medical cannabis.